a family doc and an emerge doc, so I'm on the front lines of our healthcare system. So I really see the consequences of poor health policy and poor public policy in my patients and in society writ large. So I see the downstream effects of a lack of pharmacare because medications only work if people can actually afford to pay for them. So it doesn't really make sense that we insure doctors and hospital services, and we diagnose people in hospitals and in clinics and give them a prescription to take medications, but we don't actually help them pay for those medications. And this leads to a lot of cost-related non-adherence. It leads to worse outcomes, leads to higher downstream costs in the emerge and in the hospitals. And I mean, historically, pharmacare was meant to be a part of our Medicare system. It was just implemented in stages. So firstly, with our universal hospital insurance, and then medical insurance, and then pharmacare was supposed to be the next step. It just never happened for political reasons. So it really doesn't make sense that we don't include prescription medications in our universal healthcare coverage.
I feel the exact same. I think like you, as a physician, it always felt so nonsensical that, the visit with us is covered, the visit to the hospital is covered. If someone needs diagnostic testing, that's covered. But the only piece that isn't covered is often the component that could reduce the need for so many of those other things, right? If we had people who had access to their medications, they wouldn't need to see their doctors so often. They wouldn't have, preventable complications of chronic disease. So it really does feel like this one piece of the puzzle that's missing that doesn't make any sense.